Are you taking moxifloxacin right now, or has your doctor just prescribed it for a serious infection? Here's the thing. This powerful antibiotic can literally be life-saving when you need it most. But there are some crucial things about moxifloxacin that every patient absolutely must know before taking their first dose. So stick with me for the next few minutes, because what I'm about to share could make all the difference in your treatment journey. Let me introduce you to moxifloxacin, one of the most potent fluoroquinolone antibiotics available today. This medication is specifically designed to fight serious bacterial infections that other antibiotics sometimes can't handle. But here's what makes this topic so important. Like every powerful medication, moxifloxacin comes with significant benefits that can save your life and potential risks that you need to understand. Today, I'm going to break down everything about this antibiotic in simple, easy to understand terms so you can make informed decisions about your health. Whether you're a patient, a caregiver, or just someone who wants to stay informed about important medications, this comprehensive guide will give you everything you need to know. Let's dive right in. Let's start with the basics. Moxifloxacin belongs to a powerful family of antibiotics called fluoroquinolones. Think of these as the heavy-duty fighters in the antibiotic world. The FDA first approved moxifloxacin back in 1999, and it's been helping doctors treat serious infections ever since. Now, here's something interesting. Moxifloxacin comes in several different forms depending on what your doctor needs to treat. You might get it as oral tablets that you swallow, intravenous injections for hospital use, or even as eye drops for certain eye infections. The most common brand name you'll hear is Avelox, but don't worry if your pharmacy gives you a generic version, it works exactly the same way. So how does this medication actually work? It's pretty fascinating. Moxifloxacin targets the bacteria's ability to copy their DNA. Imagine bacteria trying to photocopy themselves to multiply, but moxifloxacin breaks their copy machine. When bacteria can't copy their DNA, they simply can't multiply and survive. This stops the infection right in its tracks, giving your immune system the upper hand it needs to recover. Now let's talk about when doctors actually prescribe moxifloxacin. This isn't your everyday antibiotic, it's reserved for more serious bacterial infections. The most common use is for respiratory infections. We're talking about pneumonia, which is a serious lung infection that can be life-threatening if not treated properly. It's also prescribed for acute bronchitis when your airways become inflamed and infected, and sinusitis, those painful sinus infections that just won't go away with other treatments. But moxifloxacin doesn't stop there. Doctors also use it for complicated skin and soft tissue infections, especially when other antibiotics haven't worked. It's effective for certain stomach and abdominal infections, and believe it or not, it's even approved for treating plague. Yes, the same plague from history books, though thankfully that's extremely rare today. In some cases, moxifloxacin becomes part of treatment plans for drug-resistant tuberculosis when standard treatments fail. Here's what's really impressive. Clinical studies consistently show about a 90% success rate for respiratory infections. It's particularly effective against the specific bacteria that cause pneumonia, making it a go-to choice for doctors when patients need reliable, powerful treatment. Let me share why doctors and patients often prefer moxifloxacin over other antibiotics. These benefits make a real difference in your treatment experience. First, the convenience factor is huge: once daily dosing. Unlike many antibiotics that require multiple doses throughout the day, you only need to take moxifloxacin once every 24 hours. This makes it much easier to stick to your treatment plan. Then there's its broad-spectrum activity. Think of it as a Swiss Army knife for bacterial infections. It fights many different types of bacteria effectively. This is especially important when doctors need to start treatment before they know exactly which bacteria is causing your infection. The medication also has excellent tissue penetration. This means it doesn't just stay in your bloodstream, it actually reaches deep into your lungs, skin, and other organs where infections hide. With 90% bioavailability, your body absorbs almost every bit of the dose you take, making it highly efficient. Perhaps most importantly, moxifloxacin works against antibiotic-resistant bacteria. When other medications fail because bacteria have developed resistance, moxifloxacin often still works. Its 12-hour half-life means it stays active in your system longer, continuously fighting infection even hours after you've taken your dose. Now let's talk about side effects, because being informed helps you know what to expect. The good news is that most people tolerate moxifloxacin quite well, but it's important to know what's normal. The most common side effects are actually pretty mild and manageable. Nausea and stomach upset top the list. This might feel like butterflies in your stomach or mild queasiness, especially when you first start taking it. Some people experience diarrhea, but this is usually temporary and resolves as your body adjusts. Headaches are another common complaint, along with mild dizziness. These typically aren't severe and often improve after the first few days of treatment. If you do experience dizziness, just be careful when standing up quickly or driving. Then there are some moderate effects to be aware of. Moxifloxacin can make your skin more sensitive to sunlight, so you might sunburn more easily. It's smart to use sunscreen and limit sun exposure while taking this medication. Some patients notice joint and muscle pain, and others might have trouble sleeping or experience changes in their sleep patterns. Here's the reassuring part: clinical studies show that the vast majority of patients complete their moxifloxacin treatment without any serious problems. These side effects, while inconvenient, are generally temporary and resolve once you finish the medication course. Now I need to discuss some serious side effects. These are rare, but they're important enough that the FDA requires black box warnings, the strongest safety warnings possible. The most concerning is tendon problems, particularly tendon rupture. This risk is highest in adults over 60, especially if they're also taking corticosteroid medications. The Achilles tendon is most commonly affected, but it can happen to other tendons too. If you experience sudden, severe tendon pain or hear a pop sound, seek immediate medical attention. Another serious concern is peripheral neuropathy, nerve damage that can be permanent. This might start as numbness, tingling, or burning sensations in your hands or feet. The tricky part is that this can happen quickly and may not be reversible, which is why it's crucial to report these symptoms immediately. For patients with myasthenia gravis, a muscle weakness condition, moxifloxacin can make symptoms dangerously worse, which is why it's generally avoided in these patients. Heart-related risks include QT prolongation, which can cause irregular heart rhythms. There's also an increased risk of aortic aneurysm and dissection, particularly in elderly patients within 2 months of taking fluoroquinolones. Other serious but rare effects include severe allergic reactions, significant blood sugar changes, and central nervous system effects like confusion or hallucinations. Remember, these serious side effects are uncommon, but they require immediate medical attention if they occur. Certain people should never take moxifloxacin, and it's crucial to know if you fall into any of these categories before starting treatment. If you're allergic to moxifloxacin or any other fluoroquinolone antibiotics like ciprofloxacin or levofloxacin, this medication is absolutely off limits. Even a mild previous reaction could become severe with repeat exposure. Patients with myasthenia gravis should avoid moxifloxacin entirely. This muscle weakness condition can become life-threateningly worse with fluoroquinolone use, so doctors typically choose alternative antibiotics for these patients. Pregnancy and breastfeeding present special concerns. While not absolutely contraindicated in life-threatening situations, moxifloxacin is generally avoided during pregnancy because animal studies have shown potential for birth defects. If you're breastfeeding, the medication passes into breast milk and could affect your baby. Children and teenagers under 18 shouldn't take moxifloxacin systemically because it can interfere with normal bone and joint development. The only exception is moxifloxacin eye drops, which are considered safe for all ages. People with existing heart rhythm problems need special caution because moxifloxacin can worsen these conditions. Similarly, those with severe liver disease may not be able to process the medication safely. If you have glucose 6-phosphate dehydrogenase deficiency, a genetic enzyme deficiency, moxifloxacin could trigger a dangerous breakdown of red blood cells. Always inform your doctor about any existing medical conditions before starting this antibiotic. Drug interactions with moxifloxacin can be serious, so let's go through the most important ones you need to know about. Timing is everything with antacids, multivitamins, and supplements containing aluminum, magnesium, iron, or zinc. These can significantly reduce how much moxifloxacin your body absorbs. Here's the rule: take moxifloxacin at least 4 hours before or 8 hours after these products. Don't take them together, or you might not get the full antibiotic effect. If you're on blood thinners like warfarin, moxifloxacin can increase your risk of bleeding. Your doctor might need to check your blood clotting levels more frequently and possibly adjust your warfarin dose. Heart medications require special attention. Combining moxifloxacin with certain antiarrhythmic drugs like quinidine, procainamide, amiodarone, or sotalol can create dangerous heart rhythm problems. This combination should generally be avoided unless absolutely necessary with careful monitoring. Corticosteroids like prednisone significantly increase the risk of tendon problems when combined with moxifloxacin. If you must take both, be extra vigilant about tendon pain or swelling. For diabetics, moxifloxacin can affect blood sugar levels when combined with diabetes medications or insulin. You might experience either low or high blood sugar, so monitor your levels more closely during treatment. Some antidepressants, particularly SSRIs, may increase the risk of central nervous system side effects. Always provide your doctor with a complete list of all medications, supplements, and over-the-counter products you're taking. Getting your moxifloxacin dosage and timing right is crucial for successful treatment. Let me walk you through exactly how to take this medication properly. The standard adult dose is 400 mg once daily. This one-size-fits-most approach makes it simpler than many other antibiotics, but the duration of treatment varies significantly depending on what type of infection you're treating. For acute bronchitis or chronic bronchitis flare-ups, you'll typically take it for 5 to 7 days. Pneumonia usually requires 7 to 14 days of treatment, while sinusitis generally needs a full 10-day course. More complicated infections like skin and soft tissue problems might need anywhere from 7 to 21 days. Here's some good news: you can take moxifloxacin with or without food. It won't upset your stomach more on an empty stomach, and food doesn't significantly affect absorption. However, consistency is key. Try to take it at the same time every day to maintain steady levels in your bloodstream. This next point is absolutely critical. Complete the entire prescribed course even if you start feeling better after just a few days. Stopping early is one of the main ways bacteria develop resistance to antibiotics. Even if your symptoms disappear, some bacteria might still be alive, and you need those final doses to be completely eliminated. Set a daily alarm if you need to. Missing doses or stopping early can lead to treatment failure and potentially more serious infections that are harder to treat. While taking moxifloxacin, your healthcare team will want to keep an eye on how you're responding to treatment. Let me explain what monitoring might involve and what you should watch for yourself. Your doctor may order periodic blood tests to check your liver function, especially if you're taking moxifloxacin for an extended period or have any history of liver problems. These tests look at enzymes called ALT and AST. Elevated levels could indicate the medication is affecting your liver. If you have any heart conditions or risk factors, an electrocardiogram, or ECG, might be recommended to monitor your heart rhythm. This is particularly important because moxifloxacin can affect the electrical activity of your heart. Kidney function monitoring through blood tests might also be necessary, especially in older adults or anyone with existing kidney problems. Your doctor will check creatinine levels to make sure your kidneys are processing the medication properly. Now, here's what you need to monitor at home. Pay special attention to any tendon pain, swelling, or stiffness, particularly in your heels, shoulders, or hands. This can develop suddenly and needs immediate medical attention. Watch for any unusual neurological symptoms, numbness, tingling, burning sensations, or weakness in your extremities. These could be signs of nerve damage that require immediate evaluation. Also monitor your energy levels, mood, and mental clarity. Any confusion, hallucinations, or significant mood changes should be reported right away. Keep a simple daily log of how you're feeling. This helps you notice patterns or changes that might be important. Knowing when to seek immediate medical attention while taking moxifloxacin could literally save your life or prevent permanent damage. Let me be very clear about these warning signs. Contact your doctor immediately. Don't wait until morning or your next appointment. If you experience severe tendon pain or swelling, or if you hear or feel a pop in any tendon, especially your heel, this could indicate tendon rupture, which requires emergency treatment. Any irregular heartbeat, chest pain, or feeling like your heart is racing or skipping beats needs immediate evaluation. Don't assume it's anxiety or stress. Moxifloxacin can cause serious heart rhythm problems that need urgent medical care. Severe diarrhea, especially if it contains blood or is accompanied by severe stomach cramping, could indicate a serious intestinal infection called C. difficile colitis. This can be life-threatening if not treated promptly. Watch for signs of allergic reactions, difficulty breathing, swelling of your face, lips, tongue, or throat, severe skin rash, or hives. These can progress rapidly and become dangerous. Numbness, tingling, or burning sensations in your hands, feet, arms, or legs should never be ignored. This could be peripheral neuropathy, which can become permanent if the medication isn't stopped quickly. Any mental changes like confusion, hallucinations, severe anxiety, or thoughts of harming yourself require immediate medical attention. Remember, when in doubt, call your doctor or go to the emergency room. It's always better to be cautious with these symptoms. Healthcare providers would much rather see you for a false alarm than miss something serious that could have been prevented with early intervention. So here's the bottom line about moxifloxacin. This is a highly effective antibiotic that can successfully treat serious bacterial infections when you use it correctly. Yes, there are important side effects to watch for, but remember, millions of patients take moxifloxacin safely every year with great results. The key to success is simple. Follow your doctor's instructions exactly, complete your entire course even when you feel better, and don't hesitate to call your healthcare provider if anything feels wrong. With the right knowledge and medical supervision, moxifloxacin can be the powerful ally you need to beat your infection and get back to living your best, healthiest life. Stay informed, stay safe, and trust the process.